Hello everyone and welcome back to my channel. Sorry that I look a bit messy. I've just come out of the shower, my hair hasn't dried properly and I wanted to catch the last bit of sunshine to record this video to update you basically on what's happening with my life personally and hospital life that I work in with this whole coronavirus outbreak. So I've been getting lots of messages on my Instagram and through my YouTube comments about what I'm doing or what I'm changing with the way that I work in the hospital that I am because I'm pregnant. So initially I wasn't doing anything. Obviously I was taking the same precautions as everybody else and wearing protective gear when seeing suspected coronavirus patients or those with confirmed cases. However, as of the beginning of the week, pregnant people have now also been included in the vulnerable people category, which means that we're essentially meant to socially isolate for 12 weeks. But that social isolation, it doesn't really give us much direction about work, especially if you're working frontline in a hospital. As you know, I'm no longer doing night shifts as part of my rota because of my pregnancy. It's just too difficult for me now, and the switching between day and night shifts just messes me right up. So they've kindly taken me off night shifts. They were also going to do the same for my day shifts because they're 13-hour shifts and they can get quite long and tiring. However, I decided that I wanted to stay on doing them just for my own learning and progression. And so that means that technically I'm meant to be seeing patients in A&E and acute medical wards in addition to the ward that I work in, which is currently respiratory. As you'd imagine, we get lots of people coming in with exacerbations of their lung conditions, and so they present with cough and things like fever. So up until Tuesday, Wednesday, I was still on the ward doing my normal thing. Thankfully my team have been great and they have prevented me from seeing anyone who's a suspicious case or anyone who's in respiratory isolation for other things apart from the coronavirus. But I was getting very anxious, and the lack of guidance specifically for pregnant workers in healthcare was making me very worried, and I felt that every day that I was at work continuing my day-to-day work, I was putting myself at risk until the government and Health Education England got themselves together and produced us with guidance. So there have been some guidance provided, and this says that those who are pregnant healthcare workers should either work from home, which I can't, or should be placed in lower risk clinical areas. So I spoke to my consultants, and the plan that they've come up for me for the time being is to work in a block of offices that's within the same, so it's part of the trust but it's a different building, and I will be doing ward work remotely. So luckily my hospital about 18 months ago now has gone fully electronic, which means that all the ward round entries, all the observations, all the drug charts are now on a computer. So what I've been doing for the past 2 days is sitting at a computer in these block of offices, following my colleagues' ward round entries. So they are seeing the patients, they are assessing the patients and creating this ward round entry with the jobs at the bottom. I then create a jobs list for myself from the patients that they've seen and do anything that I can do remotely. So these include things like doing their discharge summaries, doing their TTAs, which is their takeaway medication, ordering bloods, ordering imaging, chasing up the imaging, calling the X-ray department to chase up things, speaking to relatives on the phone, updating them about their patients. For example, if it's somebody that I already knew from working there just 2 days ago, I can easily speak to the relative, or taking things like collateral histories for them, checking patients' observations and blood results, and basically updating my ward team remotely about everything that I'm doing. And I feel like so far it's been quite useful for them. I don't know how long this is going to carry on for, however, this is just an interim measure whilst they find me a more suitable working environment, and this might be what will happen for the next couple of weeks until things maybe settle down. I have no idea. But I'm so thankful for doing what I'm doing now, because I'd rather that than just sit at home feeling useless, because I really want to get out there, I really want to help, I really want to be at the front line, but then I have to think about myself as well. So that's what's going on with my life and working in hospital. So that's a little bit about me and where I stand. Obviously I'll update you as things go along because there's so much uncertainty, everything's new. I don't know how this is going to affect my training. I don't know how it's going to affect my progression. I'm trying to keep on top of things by doing e-learning modules. I'm still continuing with by attending the teaching that happens within our department. So I don't go into the hospital, but we come out into the education centre and have our little teaching sessions. You may also have questions about my GP training in general. So as you know, on Thursday afternoons, we are meant to all gather at the education centre and have a teaching session in the early afternoon, and then late afternoon we have small group works where we get together and discuss cases that we've seen and raise any issues that we'd like to discuss with the group. Now, because it's not safe to have that number of doctors in one room in case we infect each other and a whole workforce comes down, they've taken the difficult decision to cancel the teaching in person, and I think they're going to convert it to online teaching, and in the small group work we will be doing over online conference calls, so using apps, things like Zoom. It's not completely nothing. There is still some teaching and training going on, but obviously it's not the same as it was before. But I mean, considering what's going on with this outbreak and the strain on the NHS, I guess that's quite a small part of the picture. So as it comes to my hospital, our A&E department is currently split. Our majors department has been converted into an isolation unit for patients with suspected coronavirus. Those who are assessed and not deemed unwell enough to require admission are then sent home with advice to isolate by themselves or with family. Those who are sick enough to require admission, so those who need oxygen support, even severe cases like external ventilation support, are then admitted onto our wards or our ITU. Obviously our A&E is still running and we still have patients coming in for other reasons, things like kidney infections and strokes. So that's all still coming through the door in addition to our coronavirus cases. Now, we still are getting some patients who are coming in with very trivial things, some of which I won't talk about on here, but it really makes me angry. And something I wanted to raise here whilst I've got you guys' attention is that please don't come into the hospitals and steal alcohol, hand gels and masks. Because of these friends and relatives and family who are coming onto the wards and stealing these equipment, we as medical professionals are falling short, and we are having to recycle masks in between patients and having to ration our alcohol gels between staff members and between patients. So if you are coming into hospital to see your relative, please do not come in a group, come one by one, and that's only if your relative really needs to have somebody with them that you feel you need to be there for them. For example, children or elderly patients who are very confused and otherwise would love to have a relative there just to keep them from going delirious. So other than those cases, please don't come into the hospital to see inpatients, and if you are coming, do not take hospital masks and alcohol gel from the patient's beds. So as you know, as foundation trainees or GP trainees, we have 4 monthly and 6 monthly rotations. And for example, the FY2s are meant to be rotating early April, and some GP trainees and 6 monthly rotations, for example on medicine, were meant to be rotating between 2 different specialities. So I was meant to be rotating from respiratory to geriatric medicine. However, Health Education England have come out to say no rotations will be happening, everyone will stay where they are. This is a measure taken to reduce disruption to departments, because every time there's a rotation you need to have an induction for those doctors, and the way that the NHS is coping now, we just don't have the time and resources to put that time aside to do that for the new doctors. So everybody will be staying where they are. Unfortunately, that means that some people will be staying in their rotations for longer than they wanted. For example, had this happened to me last year when I was an FY2, that would have meant that I will would have carried on with A&E for a further 4 months, making it a 6 to 8 month rotation. That also applies to me. I won't be rotating to my geriatric rotation. Now, I don't know what that would mean for me anyway, because I'm currently off the wards, but it won't mean a massive disruption because I'm still within a medical setting. As with other things, as you know, lots of routine surgeries and routine appointments have been cancelled. This means that other specialities such as surgery and gynecology have slightly less patients to see than they would otherwise, so excluding their emergencies that come through the door. And so that means that they'll be deployed to help the medical team see medical patients, and other specialities include things like anaesthetists. And I feel like this is happening already. So just last week on our set of nights, I know that the gynecology team were helping with the medical take just because they didn't have many patients and they knew how stressed and snowed under the medical team was, so they all just got together. And seeing everyone get together and the team spirit that happens is just so heartwarming, and it's just lovely to see people coming together for patient safety. But it's also very upsetting that I can't be one of them, because usually I just like to be there, I just like to get on with things, you know, get the job done, look after patients. But I'm in a difficult situation myself. So what are the departments doing in general? Routine appointments are not going ahead face to face. Majority of them are being converted into telephone consultations. As you'd gather, most of these routine follow-up appointments don't require the physician to examine you anyway, and so you don't physically need to come in, and reviewing your results or your bloods and your scans over the phone and having that conversation over the phone is usually sufficient enough. Now, if they feel that any patient needs to physically come in, they will book them separate appointments and have slots for them to come in. This doesn't mean, however, that the cancer pathways are affected. So the 2-week cancer pathways are still going ahead. The investigations for them are still going ahead. But obviously now that GPs are not seeing patients face to face and are discouraging people that aren't acutely unwell to see them, I don't know what the repercussions of this will be for the upcoming years. It's very scary to think about the long-term effects of outbreak is going to be on public health, and it's going to be interesting to see where we end up in the next few years. I just celebrated my 30th birthday last week. I feel very lucky that I was able to still go out during that time and celebrate with my friends before they recommended social isolation. I don't know if you can see my birthday balloons in the background. I was meant to originally do a video all about my 30th birthday and how I spent it and the fun that I had, but I wanted to get this video out to you guys before that because there's so many questions and that I can't even answer, and there's so many questions that you guys are worried about. But let me know in the comments if you still would like to see my birthday video. So a little bit about what I've changed in my household as a result of all of this. So we are no longer going out even to see friends and family. I'm getting my husband to go out to do the shopping, then he comes home. We wash all the shopping, so all the packages, all the fruits we undo from the packages, all the bottles of milk and everything, I just wash quickly under the sink and leave to dry, because obviously I don't know who's touched them, I don't know who's done what to them. My husband then goes upstairs and has a shower, and then he gets on with his work. So he's lucky enough that he can work from home. He went to, I think it was Tesco's today, and he got there for about 6:30. Even then it was rammed inside, and he was saying by the time I got to the tills, the queues for each of the tills were reaching the end of the aisles. And it's really hard because, especially when you're working in healthcare, sometimes you don't have time to go really early in the morning, and sometimes the only time you can really go out shopping is late in the evening or on the weekends, and this is when majority of the stuff have been taken off the shelves. And I think some supermarkets are now including NHS workers in the vulnerable group, so allowing them to come in with the elderly for an hour earlier than the general public to do their shopping, because we physically can't buy anything, because by the time we get there after our shifts it's all gone. That's one thing. We are no longer accepting visitors. We are being very stringent with cleaning, but what we are not doing is stockpiling, particularly things like toilet tissue, hand wash, you know, frozen veg. I understand that the shops will still remain open even if we were to go into the worst situation, which is into lockdown. And I just don't think it's fair on other people who, for example, can't get to the shops earlier, elderly people, vulnerable people, and people who live on a week-by-week basis with their wages, who are not fortunate enough to earn enough to be able to stockpile. And also the inflated prices that some supermarkets are putting on some products. It's just not fair, and I just don't feel like I want to contribute to that. So as much as I can, I'm still continuing with the normal amount of shopping that I'm doing. Maybe buying a extra packet of pasta, if anything, and that's it. I'm not doing anything extra, and I urge you guys, although it's very stressful, to not do that as well. You know, worst case scenario is if you had to be isolated, you can always do online shopping. We're in an era where we are very lucky enough to have all the technology around us, and we can get food delivered, we can get shopping delivered, we've got friends and family who can help. So for the sake of people who aren't able to stockpile like you, please be very mindful of them as well. As for my antenatal appointments, we have been given guidance from the Royal College of Obstetrics to still continue attending our antenatal appointments as normal, but obviously if we are symptomatic with cough, fever or anything else, to stay away from the hospital and to call our midwives for advice. So I've got my midwife appointment in a couple of weeks. I'm hoping if I'm still well by then, I'll go in for my routine appointment as usual. So that's it for this video, guys. Thank you very much for watching. Sorry it's not chirpy and cheerful as all my other videos. The lecture I'm holding in May is still going ahead. Depending on what happens with the situation, I feel like things will settle down by then, but if not, I'll convert it to an online platform for those who have tickets or want to buy tickets to join. So you can still go on the link in the description below to check that out and buy your tickets if you're interested. The lecture is all about getting into medicine and sharing my knowledge with all of you guys. I will try to do updated videos on this, telling you about what's changing with my hospital, with my training personally, how I'm working differently, and just keeping you guys updated on everything that's happening. Everything is changing on a daily basis and it's quite scary. It just feels so surreal. It feels like it's a film, and if I had seen this in the cinema, I'd think, oh God, like that's never gonna happen. But here we are, social isolation, people stockpiling, people worried, people dying. It's all happening, guys. Let's stay positive. Let's keep each other updated. Please don't share fake news. Please don't stockpile, and keep tuned. I'll see you in my next video. Bye.